executive pastor. Well, good afternoon, everyone. My name is Fraser Pope. I am the executive pastor here at the Fellowship Missionary Baptist Church, affectionately known as Fellowship Chicago, right here on 45th Place and Princeton Avenue on the south side of Chicago. And we are just so delighted to be in partnership with so many great organizations today. The Red Cross, Eagle, Vertex, Hill Collaborative, and many, many more as we talk, have this community conversation about what is sickle cell. And before we get started, I would like to open us up with a word of prayer, and we will continue on with our conversation. God, we come to you now grateful for who you are, grateful that you are a God who knows all about us. God, we know that you know all the various things that are going on with us, wherever we may find ourselves today. And God, we're grateful for even giving us this space today to talk about a health concern that is challenging so many here in the United States and abroad. So God, we ask that you be with us today as we have this discussion. Allow the information that is disseminated to fall on fresh hearts, fresh ears, so that we might be able to go back into our various communities, go back to our places of influence, and help somebody with this information that we learned today. Thank you in advance for the great things that shall come from today. It's in Jesus' name we pray. Amen. Amen. Again, we want to thank each and every one of you for joining us. And I want you to know that we have some very, very special people who are helping us today. We have the Hill Collaborative in Vertex Therapeutics, and we want to welcome each and every one of these individuals who will be joining us today. And I have the privilege and pleasure of introducing our panelists. I'm stepping in this afternoon for Tone Capone, but we do have Miss Marilyn Baker. She's the Regional Director of Patient Advocacy in Vertex Chicago. Dr. Santosh Saruf, Director of Translational Research, Sickle Cell Center, Associate Professor of Medicine, Division of Hematology Oncology at UI Health. Jocelyn Mallard, she is a sickle cell pediatric nurse practitioner, transition care coordinator at UI Health. Renisha T. Edwards Elliott. She is a sickle cell disease professional advocate at UI Health. Janine Hopkins, the sickle cell account manager, Red Cross. Ryan Cameron Cooper, he's a pediatric research specialist and peer patient advocate. And last but certainly not least, Shantice Allen, a peer patient advocate with UI Health SCD transition program. So I would like for Miss Baker, Miss Marilyn Baker, to come and share a brief info about Vertex and the program.
Thank you so much, Pastor Pope. I hope everyone can hear me. So again, my name is Mary Ellen Baker, and I'm the Regional Director of Patient Advocacy for the Midwest at Vertex Pharmaceuticals. It's an honor to be here with all of you today, albeit virtually, for today's event. And in case you're not familiar with Vertex, we are a global biotechnology company headquartered in Boston. Our mission is to invest in scientific innovation to create transformative medicines for serious diseases like cystic fibrosis, beta thalassemia, sickle cell disease, and severe kidney diseases. We like to think we're a different kind of biotech company. We go after some of the most difficult scientific problems and always focus our efforts on addressing the root cause of disease rather than the symptoms. At the end of the day, our goal is to transform the lives of people living with serious diseases. It's a passion shared by every employee at Vertex. We often refer to patients as our true north. They're our single source of inspiration and motivation. Every decision we make and every step of the drug discovery process is with patients in mind. Today, I'm grateful we have the opportunity to support this event and these important conversations about the state of sickle cell disease in America. We're excited to be able to join in these efforts to recognize sickle cell, shining a light at events like these and through many partnerships with community and advocacy groups across the country. For far too many, sickle cell disease means years of painful crisis, blood transfusions, and hospitalizations, and tragically, a lifetime that is approximately 40 years shorter than the average US adult. There is much that we can all do together to work toward a brighter future for sickle cell patients. At Vertex, we are continuing our research for gene editing approaches for the potential treatment of sickle cell disease using CRISPR-Cas9 technology. We hope this investigational treatment might someday provide an important new treatment option for patients living with this life-shortening disease. Thank you to Fellowship Missionary Baptist Church and HEAL Collaborative and the amazing community of patients, caregivers, and other advocates and supporters for the opportunity to participate in this event. We look forward to listening, learning, and sharing, and ultimately finding ways that we can all work together to show that we are stronger together. Thank you again.
Thank you, Marilyn and Vertex, for your work in this space. I want to introduce you to one of our content experts, Dr. Santosh Saraf. He's a hematologist oncologist at UI Health.
Hi, my name is Quinn Taylor with the HEAL Collaborative. Today we have joining us Dr. Santosh Saraf. How are you today, Dr. Saraf?
I'm doing great. How are you doing?
I am well. We've had you come in and be a part of previous sickle cell disease events in the past, and I would love if you would introduce yourself to the audience and let them know who you are.
Sure. Yeah, it's a pleasure to be a part of this program again, and thank you for the invitation. My name is Santosh Saraf. I'm an adult hematologist, and I focus my practice on caring for people with sickle cell disease, particularly adults with sickle cell disease.
Awesome. I know in our previous conversation, you kind of educated and empowered us about what sickle cell disease is. And since that's that's the theme of this community conversation, you also talk about the complications of living with sickle cell disease. Oftentimes, we just think about the blood cell part of it, but there's so much more to it. And if you could just kind of talk about that, we would really like to hear that part.
Yeah, my pleasure. So sickle cell disease is an inherited red blood cell disorder. And what happens is when the red cell gives off oxygen, the hemoglobin collapses and it causes the red blood cell to sickle. And what's important to remember is that the red cells in the blood flows all throughout the body. And so we often think about sickle cell and the pain crises, but there's a lot more that happens that isn't as obvious to us. And so I often kind of think about the body from head to toe and how it can be affected by sickle cell disease. And really, all of the major organ systems can get affected. Um, Oftentimes, you don't notice the problems right away, but these are some things that we can detect by screening through blood and urine tests. And it's really important to do that before it becomes more of a problem and does cause symptoms.
Screenings are so important, and making sure that patients have access to them and are able to get them regularly and followed up is the difference between life having a good quality of life and having a uncomfortable quality of life. So you said that sickle cell impacts different organ systems. What are some of the organ systems that are impacted by this disease?
Yeah, if you think from head to toe, I can't think of an organ system that might not be affected. So, starting at the top, our brain is often very sensitive to changes in blood flow or reduced oxygen delivery from the anemia. And so, the brain can be at risk for things like stroke. But another problem that can happen that's not as obvious as a stroke is a silent stroke. And this happens in probably up to half of people with sickle cell disease by adulthood. And this can cause problems, especially cognitive problems. So this can cause problems remembering things. It can be problems following directions, like remembering what medicines to take. But it can also impact schooling. So it can impact how you retain information. And it's something that we can screen for with neuropsychological testing. And it's highly recommended that a lot of our children, especially when they're getting into high school or starting college, get this because if we see some problems, we can actually help advocate for our patients and get extended timing for exams, excused absences, or kind of being able to hand in some assignments a little bit more later, kind of accommodating for these kind of problems. So the brain is one of the most important organ systems that can be affected.
And I
Moving.
ask you, what is a silent stroke?
So a silent stroke. So normally a stroke is where you've lost blood supply to the brain. And this will cause things like problems with using an arm or a leg. You'll notice numbness or weakness or maybe a vision change. So that's an obvious or an overt stroke. A silent stroke is where blood supply or damage to the brain is happening, but you don't really notice it physically. And so this is something that's happening kind of subclinical or kind of silently. And it's going to cause long-term changes, but it's not something that's really obvious that you notice right away. It might be something that slowly accumulates, or it might be something that needs to get identified by a really special testing, like this neuropsychologic testing.
Wow, that's so important to know because if you don't have the knowledge that something like that can happen, you'll continue going on and not even know that you know you're feeling the effects of the silent stroke, but you have no knowledge that there is a thing called a silent stroke. So you really don't know what to ask your care provider or healthcare provider when you go in. That's great information. What other organ systems does sickle cell impact?
Yeah, so going down, the next organ system is your vision or your eyes. And so in the back of our eyes, we have a retina. And that's kind of, I always kind of think of it as like a movie screen. So images that we're seeing coming in, they go onto this movie screen in the back of our eyes. And this screen requires a lot of good blood vessels and flow. And if there's any sickling or damage to these blood vessels, over time, the retina can get damaged. And so it's really important to get an annual retinal evaluation where you see a specialist, an eye specialist. They'll do the drops in the eyes and look at the back of the eye, that movie screen, to see if there's any damage to the blood vessels. And this is critical because um, a lot of times when you see floaters, that could be an early sign of damage to the retina. If you have an increase in floaters, especially with some vision changes, that can be a really good clue that there's problems happening. And if you can catch it early enough, those damaged blood vessels can be treated before they actually burst and bleed. If they burst and bleed, that can cause something called retinal detachment, where the movie screen gets damaged and moved off of the eye, and then you can lose vision in that area of the retina, or of the field of vision.
Wow. Um, and I'll let you keep going down the body.
And so that's why it's really important to get that screening at least annually. Sometimes if people look like it's clear, then it's every other year. So I'm going to keep going down. So next is kind of some vital organs that we have in our kind of central area in our thorax, and that includes the heart and the lungs. So the lungs are something that we know can get damaged because of pneumonia or acute chest syndrome, and that's something that's kind of sudden, and you'll have those symptoms of cough, fevers, trouble breathing. But sometimes, if that happens frequently, or if you have other damage happening to the blood vessels, you can get scarring or kind of long-term changes to the lungs. We often kind of think about these changes in people that smoke, called COPD, but very similar findings can happen in people with sickle cell disease. And so if you're noticing more trouble breathing, a constant cough or wheezing, then we order something called pulmonary function tests. And this is very similar to what we do for evaluating for COPD. We could see if bronchodilators could help. We also have a pulmonary specialist evaluate the person to see if pulmonary physical therapy could also help.
It's interesting how so many of these symptoms um, resemble other diseases. So if you're not regularly getting screened, you might mistake it for something else.
Right.
That's very insightful. So I'll let you keep going down the body.
Yeah, and so those pulmonary function tests are great for kind of looking at how the lungs are kind of inhaling and exhaling air. The other really important organ in the thorax is the chest. I'm sorry, the heart. And So the heart is working overtime because we know that with sickle cell anemia, you have less hemoglobin and red blood cells to carry oxygen. So the way I kind of think about it is the heart is constantly working overtime. And over the long run, we could potentially see some changes to the heart that kind of are maladaptive. And so the best way to screen for changes in the heart is a heart ultrasound, or called an echocardiogram. And this is where, just like they do an ultrasound to look at a baby for a pregnant mom, it's the same ultrasound that they'll use to look at the chest area, and they'll look at the different parts of the heart and also the heart valves. And what we try to screen for, especially in people with sickle cell disease, is that as the heart is pumping over time, that heart is a muscle. And just like other muscles, if it's overworked, the muscles get thicker and bigger. Well, that can also happen to the heart, and we don't want that to happen. We see in about 25% of people with sickle cell disease. And if the heart muscle thickens too much, that affects how much blood can go in. And that's called diastolic heart failure. And so that's something that we need to screen for, because maintaining blood flow is critical, especially in sickle cell disease. That's one thing that we can look for with the heart ultrasound. The other thing that's related to the lungs is that we have two circuits in our body: the circuit of blood that pumps blood through the lungs to get oxygenated, and then the circuit that sends it through the rest of the body to deliver those oxygenated red blood cells. Well, in that lung circulation, if the blood's not flowing well, it can cause something called pulmonary hypertension. And that's also something that we can screen for with the echocardiogram. What we'll see is that there's a lot of pressure and something called tricuspid regurgitant jet velocity, or TRJ, will increase. And that is kind of a good red flag that pulmonary hypertension is happening, and we need to manage it and make sure that we're preventing the heart and lung damage from happening long term.
Wow.
And just like how you have high blood pressure medicines that'll help lower the blood pressure in the main circuit, there are special medicines that'll help lower the blood pressure in that pulmonary circuit that'll help with the pulmonary hypertension. So it's good to screen for it, and then it's important to treat it if we see that.
So the disease spaces that we always like to educate people on are the kidneys. So how does sickle cell impact your kidneys?
Yeah, this is something that's very near and dear to me, because we've looked a lot at um, the different organ systems, and what's been really surprising is that kidney disease is probably one of the most vital organ systems that can get affected in sickle cell disease. And the kidneys, we often think about it as just making urine, but the kidney has a lot of different functions that are really important for our body to kind of maintain our health. So it is very important in maintaining our fluid balance and preventing us from being dehydrated, which we know is a very important trigger for a crisis. So it has that important role, but it also regulates a lot of other things. Surprisingly, it produces a hormone called EPO. And this is actually a hormone that tells our body to make red blood cells. And so we know that this is critical in sickle cell disease, because we're already having anemia. If you don't have this, the anemia could get worse. So the kidney tells our body to make red blood cells. The kidney also makes the active form of vitamin D, and vitamin D is critical for good bone health. So if we don't have enough vitamin D, our bones are going to get weak. And some people from Emory University have shown that if vitamin D is low, people with sickle cell disease have more crises. And if we can supplement the vitamin D and help keep it at a good level, this will reduce vaso-occlusive crises. The kidneys also regulate our acid and base balance, so something called the pH, or our acid levels. And we don't want to have too much acid levels in our body, because if we do, that actually also promotes red blood cell sickling. So all these different things that are really central to keeping our patients healthy from the sickle cell disease, a lot of that is managed by the kidneys. And when we look at the kidney damage, we see that this is happening at a pretty young age. And so one of the ways that we screen for it is we look for albumin in the urine, or albuminuria. And this is one of the earliest signs that the kidney, the main unit in the kidney that helps filter the blood, that there's some damage happening in there. And so if we see some albuminuria, that tells us that we got to be extra aggressive on maintaining the blood pressure. We have to think about hydroxyurea or other kind of therapies to help calm down the sickle cell disease, but also thinking about some medicines that might help protect the kidneys. right now, the American Society of Hematology has a recommendation for a group of medicines called ACE inhibitors or angiotensin receptor blockers. And this helps lower the pressure in the kidney and helps protect it. And so those kind of treatments can help prevent or improve the albuminuria and help protect the kidney long term.
Wow, that's people don't always recognize how important your kidneys are. Like you said, they just think about urine, but they're so vital in your body, and they do connect with that red blood cell, the ferritin, iron storage. And if
Mhm.
you're already having problems with, that with your blood in general, and it's not regenerating, like you said, I can't even imagine how that impacts patients. Is there any other organ systems that sickle cell impacts?
Yeah, so one of the other ones, and you kind of touched upon it, Quinn, was iron overload. And so with each unit of blood, our body is getting a lot of iron put into the body. And our body is not very good at getting rid of iron. Through evolution, our bodies tried to keep iron as much as possible. And so with lots of transfusions, iron can accumulate in the liver.
Wow.
And so one of the things that we can screen for is something called ferritin. You can do that in the blood, and we follow that. I usually try to follow that annually, and if we see that the level is increasing, then I try to be really careful because that especially accumulates in the liver. And the liver and the kidney, these are two organ systems that don't get a lot of credit, but are really, really vital for maintaining our health. The liver makes a lot of really important proteins. It's kind of like the manufacturing plant for our body. And so if the liver is not working well, a lot of important proteins don't get made, and our patients can run into big trouble. And so if we make sure that the iron isn't getting accumulated in there too fast and too largely, then we can try to help preserve the liver function. So we monitor the ferritin levels. If it's high, then we also have some medicines that'll help chelate or remove iron out of the body. So those are things that we could offer to our patients.
Wow. So I'll say I was privy to this conversation a couple days ago, and I was absolutely blown away by how much of the body holistically is impacted when you have sickle cell disease. You hear about crisis, you hear about, things like that, but it really does. One thing really does knock everything in your body out of whack. And now I see why patients with sickle cell um, have so many problems or trouble just trying to manage it. I know that we've also talked about transition of care, going from pediatric care to adult care, and in learning more about sickle cell, I find that this is a subject that people often, especially patients, bring up, how hard it is when they go through crises and they want something. They're written off as drug seeking or things like that. But even hearing this part of it, I'm sure as an adult with sickle cell disease, as you get older, it's probably more important that you get these screenings, like you said, to ensure that your other organ systems are still functioning and functioning well. So, what would be your advice to patients transitioning into adult care, and what they should do to ensure that they're getting these screenings and they're getting access to everything they need to ensure that they're staying as healthy as they can?
Yeah, that's a lot of great points that you brought up, Quinn. And that transition age is really challenging. We've have good therapies, we have good screening, and a lot of our children, the large majority of our children are surviving into adulthood, and we've done a great job with that. But I think the next hurdle is making sure that our children keep doing well into adulthood, so that we're pushing that the survival and the improvement in the complications and everything to continue to improve. And the transition age is particularly hard because people with sickle cell disease, they've had a care provider since birth, and now suddenly they have to entrust a new provider in the adult kind of arena. And this kind of requires education on two aspects, both for the patient to know what to ask for and what to advocate for, but also on our end as providers. And so we have to make sure that the providers are screening for these different organ problems. And so in that transition period between about 18 and 21 years old, you want to make sure that you have a good assessment of how the body is doing. So you want to know, what is the neurologic status like? Do a neurocognitive testing. Are there any areas that we need to kind of help the patients, especially kind of like having an unlimited exam time or other kind of assignment improvements? There are also different therapies that we can do to help prevent the silent strokes or the overt strokes from happening. Making sure that they're getting annual retinal evaluations, evaluating for lung problems, getting a baseline heart ultrasound, and then doing the screening for the kidney and for the liver. So those are all really important to start at this age period, because if you catch it earlier, you can treat it and prevent it from causing organ failure in the future.
No, that's great. And I especially like the part where you say if you let the patients know these things, they can advocate for themselves, because we always want to empower patients and have them feel comfortable being an active part of their care team. Because most times they have to be self-motivated to kind of keep these things up to date and keep these screenings, making sure they get completed. So, no, this has been phenomenal information. I'm so glad you were able to share with us, Dr. Saraf. And I thank you again for being a part of this program and sharing your wisdom and your knowledge with us. It has been phenomenal.
It's always a pleasure to help work with your team and work with you. So always a pleasure.
Thank you so much.
So thanks to Dr. Saraf at UI Health for giving us all better insight on how SCD impacts a person holistically. Now I want to introduce you to Nurse Jocelyn and Ronisha. How are you doing this afternoon? Good to see you.
Doing well. Thank you so much. Doing very well.
Wonderful. Ronisha, I think you were on mute a little bit.
You are correct. How are you doing? Thank you for asking.
I'm doing good. Good to see you both. Nurse Jocelyn, how can you share with us about the importance of having a great healthcare team as a SCD patient transitions from pediatric care to adult care?
That's an excellent question. I believe that the purpose of your healthcare team when you're in pediatrics is really to prepare you to make that transition to adult care. So part of the team should be adult sickle cell docs as well. And that's one of the things that we're doing at UI Health, is trying to bridge the gap between the pediatric patient and the adults by having that collaborative. So we work closely with Dr. Saraf. I'm so glad he was able to be here today. But we work closely with him and the other adult providers using our STAR Clinic Transition Program to help prepare those adolescent patients and get them accustomed to moving into the adult world, because it's very important. If you look at statistics, the rate of death between 19 and 35 years old, so that's that transition age, increases sixfold from a pediatric environment to an adult environment. And that's very significant. So what happens to those patients is critical to, obviously, to their survival. So having a robust transition program helps keep them in the fold, helps keep them engaged in their care, which will allow them to transition into adulthood successfully.
Wow. Thank you for that. Thank you for that information. Ronisha, can you explain the difference between sickle cell disease and sickle cell anemia, and how the STAR program can set adult patients up to have a successful adult care and an improved quality of life?
Yes. So many people get sickle cell disease and sickle cell anemia confused and do not understand that there are many different variations of sickle cell disease. So when we're looking at someone who has sickle cell anemia, we're saying that that person has SS. They receive both hemoglobin S from their parents, whereas someone else may receive different fractions of hemoglobin, such as hemoglobin beta thalassemia plus. Also, they may have SC disease, meaning that both parents did not provide that sickle cell S gene, but they provided something that caused that child to have a form of sickle cell disease. Um, Scientifically, it may be thought of that those different forms are not as severe as sickle cell SS, but each patient has their own different experience with the disease, and all are important to understand that this population is extremely affected by it. And your second question was, again, please.
The STAR program, how can it set adult patients up to have successful adult care and improve quality of life?
So the STAR program is a great program, which is a co-localized clinic. And so from a co-localized clinic, pediatric young emerging adult patients are receiving their pediatric care, but they are getting acclimated to the adult setting. They're getting to know the difference between what may have seemed as, child care and now what they may have to get used to in adult care. So they're meeting those nurses. They're learning the sign-in process while still seeing their provider. Another great addition in our STAR clinic and how it improves quality of life is that we have included a peer patient advocate program. So that patient is receiving some peer mentorship in addition to that co-localized clinic with their healthcare team. They are having patients who have successfully, or what we deem to be a successful transition, in their care. And so something that's important to understand is that transition is not a one-day process. You are sickle cell disease, you are transitioning at every stage of life. Even myself, even as a professional patient advocate, I'm still a patient. And transition can happen at 29, 35, the same way it did at 18, because sickle cell disease is so unpredictable. And we're learning every day how to manage our disease in our life. So STAR Clinic is putting a community aspect along with a health perspective, because we can't just transition a patient's health and not really understand the elements that are affecting their life. It's a whole holistic transition, and it allows patients to feel supported in every avenue of their health.
Thank you both so much for these wonderful insights on SCD. Who else out there is being educated? Go ahead and write it in the chat. Let me know. Let everybody know what you're learning and that you are learning. I'm learning so much about SCD. Now I want to introduce our patient advocacy panelists. Uh, First, I want to introduce Miss Janine Hopkins. Miss Janine Hopkins. We also have Mr. Ryan Cameron Cooper and Shantice Allen. Good to see each of you.
Thank you so much for having me. Are you able to hear me okay?
I'm able to hear you greatly. It's
Nice.
so good to have you.
Thank you
And
so
yeah, the American Red Cross we're really putting our feet in the community there, and they're increasing their blood donations, especially while we're experiencing a shortage of blood at this time. Can you tell me why blood donation is important in the Black community?
Absolutely. So I work for the Red Cross, and my title is called the Sickle Cell Account Manager. So in my role, I partner with Black community-based organizations, schools, churches, fraternities, sororities, nonprofit, elected officials, anybody and everybody to educate the Black community on the need for blood and the critical role that blood donors who are Black play in helping sickle cell patients. So these organizations, we partner together, and they will be encouraged to host a blood drive so that we can provide opportunities for people in our communities to donate blood. Here at the Red Cross, we have what's called a sickle cell initiative. And so our efforts, we're working towards tripling the number of donors who happen to be Black by the year 2025. So this is a national effort. So all across the country, we have banded together to say we've got to help and put a fight to this. And so by the end of 2025, we want to triple the number of Black Americans who are donating blood. And so what this will do is this will help the Red Cross what we call closing the gap. And there's a gap between the hospital demands and the number of Black donors who are donating. So our efforts are to close that gap so that we can meet the hospital demands, as well as provide the most compatible blood for patients with sickle cell disease. Now, with blood donations, oh, go ahead. I'm sorry.
Please continue.
Okay. Right now, there is no widely available cure. And so the Red Cross, in our efforts, we're supporting one of the most critical treatments of all, and that is blood transfusions. Now, not all sickle cell patients require blood transfusions, but many of them do. And so a close blood match is essential for those who are requiring frequent blood transfusions. So it's important to have blood that matches other factors beyond the basic blood type. And so a recipient of blood is more likely to find the most compatible match in donors who share the same race and ethnic backgrounds. So with sickle cell being so prevalent in the Black and African American community, of the 100,000 Americans living with this disease, about 90% of them are Black and of African American descent. So they look like you and me. They look like our friends at school, our cousins, our sisters, our brothers, our nieces, our aunties. And so that's what we're here to do. We want to find the most compatible blood for those patients with sickle cell. So, we're just really excited, and that's why we're so happy to be partnering with Fellowship in this way. And to be honest with you, right now, as we speak, we are here at the Fellowship Hall at Fellowship doing a blood drive right now. Do you mind if I turn my camera so we can see the blood drive happening right now?
Please. I think I know where that place is.
I think you do. So right behind me, we have the blood drive happening right now. And so Fellowship in the community here in this area of town, we said, let's partner together and let's get some donors out. And so we do still have several appointment slots still open. We're going to be here till 6 p.m. And Pastor Pope, the address, 4543 South Princeton, right here in Chicago. So come join us. We have plenty of slots available. We want to fill these slots and help our friends and family with sickle cell disease, especially those who require blood transfusions.
Absolutely.
So, when people come to donate blood, they present and they self-identify themselves as African American. So their blood is tested to see if they have the sickle cell trait. So we perform the service for free for two reasons. Not only to provide insight to the community, because not people talk a lot about sickle cell disease, and not even a lot of people know their status. So we want to provide that status to people when they come donate blood. And then it's also helpful to us directly, because in that way we can find the most compatible match for those patients who are battling sickle cell disease.
Awesome. That is so awesome. So, Shantice, is that saying it correct?
Yes, it's Shantice.
Shantice, okay. From your perspective, why are blood transfusions so important?
Say it again. You said
why are blood transfusions so important?
Blood transfusions are extremely important because, for obvious reasons that we have a blood disorder, but everything in the community, we have to help each other and things like that. And if we don't receive, clean blood or things like that, then a lot of patients aren't able to get those transfusions. And I know a lot of patients really rely on transfusions. Some don't, some do. But I know a lot of patients really, really rely on those transfusions, and it makes the difference on how they're doing that month or that week or, things of that nature. But Jocelyn, she's better at the transfusion question, because I'm actually a sickle cell patient who does not get transfusions often. So she would probably better answer that.
And I'm here to answer that question. Blood transfusions are standard of care for patients who have suffered stroke, either overt stroke or silent stroke. That is standard of care. So they may have transfusions either once every 4 weeks, once every 3 weeks. It depends on the parameters set forth by the hematologist. So that is critical. And one of the severe diseases or severe complications of sickle cell can be acute chest syndrome. And one of the treatments for acute chest syndrome is a blood transfusion, depending on the severity of the disease. So for sickle cell patients, some, as Shanti said, that's their lifeline, to have blood transfusions and to have them frequently. And for others, it can be something that they need for intermittent sickle cell disease complications. So at our facility, we have quite a few patients, and even young patients, 2 years old, 3 years old, 5 years old, who have suffered stroke, who are on a chronic transfusion therapy program. So it's very important. What Janine is doing for the community is extremely important, and we definitely support her and ask that African Americans do come out and donate blood.
Absolutely, absolutely. So, Janine, can you tell us again, how can we come out today and donate? What do we need to do to make that happen?
Get in your car and drive over here. No, for those who are in Chicago, we definitely have a few appointment slots available this afternoon. If say like today is not the best day, I strategically do partner with various organizations around the city and actually around the state, to be honest with you. I have a blood drive in Springfield on Saturday, so I'm all over trying to collect blood for this specific cause to make sure that we're able to support patients with sickle cell disease. Now, I would like to add that because this is such an urgent need in the Black community, we have special thank yous to our donors for coming to give blood. You get a $20 gift card by email from our friends at Amazon. They have really stepped up to help with this cause. And then we also have this shirt. You probably can't see it, but it's a long sleeve t-shirt. I'm so proud of it. Our blood saves lives. And for those organizations that want to partner with us with the American Red Cross and host blood drives, we also have a special thank you to those organizations as well. So if you or anybody you know belongs to a church or organization that would like to partner with me, please give me a call. I don't mind. I would love to take your information. I can be reached directly at 312-720-7791. And we can definitely put my contact information in the comments. But yeah, look for me, look for us. We are out in the community. We're constantly trying to grow these efforts and really partner strategically with people to especially get the word out to educate and inspire people to donate blood.
Thank you. Thank you so much for that. And I'm certain several organizations will be reaching out to help the fight.
That's right.
To get more donations. Thank you all again for being here today. I want to transition now. Now we will have our peer patient advocates. These young people are doing some amazing things, not only in helping others with SCD, but they're also managing their own SCD. So let's hear their stories of triumph.
So I'll go first. So basically, when transitioning from like child care to adult care is extremely, extremely important because they are two different worlds. And as peer patient advocates, we help them go through their transition because if you're not equipped with the right tools, it can be extremely hard to navigate your care. Me, on the other hand, I had what's considered a successful transition. And I truly believe it was successful because early on, my pediatric physician, he introduced me to the adult doctors very early on. So I was already familiar with them. I would sometimes speak to them. Sometimes they would be at the appointment. It was kind of already just like a community. It was already a community. So once it was time for me to transition, I wasn't so not knowing about anything, or I didn't know who the doctor was or things like that. When it was time for me to transition, I was extremely comfortable because, like Ranisha said, it wasn't a one-day thing. I had already seen these physicians at plenty of appointments and things like that. So I was extremely comfortable with coming to them, talking to them when I had a question or anything. So I really believe building that relationship created a gap, created a place where I was so comfortable and my transition process was easier. It wasn't, like no problems, but it was extremely easier because I was already in a comfortable space. So as peer patient advocates, our goal and our mission is to help them navigate their care, advocate for themselves, because as doctors and nurses, they understand the academic part, But as peer patient advocates, we really truly understand the part of the experience and the life part and the things that other people can't understand. So it's important to us to help them while they're transitioning and give them the right tools so that it can be a little bit easier for them.
Yeah, that's great work you're doing. How about your perspective, Ronisha?
Thank you, Shantice, for that and helping everyone understand the importance of the peer patient advocate program. So I was quite opposite. I did not transition in what is deemed to be successful, which is why I was able to grow into developing this program. What we're essentially doing is creating things to help patients not experience the adverse effects that I and so many others have experienced from not properly transitioning. And so by not being proper transition, at the age of 18, I found myself 3 years without being connected to a physician. And if you may not know much about sickle cell disease, but if you have any idea or can fathom what it is to live like with a chronic illness, no one should be disconnected from care for that long. And so what we're doing as peer patient advocates is not just mentorship for patients, but we are bridging the gap between patients and the medical community. We are allowing patients to understand that they are experts in their disease, that they can take ownership and be autonomous in their healthcare decision making, that you're never too young to start and to understand your body and to help others and advocate for yourself to understand your body. So I did not transition. It affected me in college, but that made me have a passion to want to help other patients. And I'm so fortunate to have people like Shantice, who are now my community and the community of so many other patients, so that we can change the stigma of sickle cell disease.
Listen, the work you all are doing is life changing, and I commend you. I commend you for using your experiences to help someone else. Um, you are caregivers, and so I will be praying for you personally, and I know our community will be praying for you as well as you continue to do this great work you're doing, so that others might be able to transition well. Again, thank you so much. You're saving lives, and we give you props for paying it forward. Absolutely. For those in the chat, for those who are watching, I know we all have tons of questions, but I want to ask you to please put your question in the chat, and we want to make sure that we get you the answers you need. We don't want you to get all this education and not properly explain it to you. Uh, I want to thank each and every one of our panelists who joined us today. Thank you for helping us understand SCD on a different level and another level. I want to thank Ms. Vanessa Garcia, who works here at Fellowship Chicago, helping coordinate this effort. And I want to thank our partners, HEAL. I want to thank our sponsors, Vertex Therapeutics and the HEAL Collaborative. Thank you, Eagle Clinical Research, American Red Cross, the STAR program. Thank you to each and every one of you. You see there on the screen more information that is available, and you all can go to those various avenues and get as much information as you desire. And we want you to know also, we do have one question in the chat. Let's see here. Hello, I'm a pharmacist, and my very best friend and fellow pharmacist passed away at 49. So sorry to hear that. Of sickle cell in 2017. What further treatments have been developed since 2017?
So I did put an answer to that in the chat, on the Facebook chat. But just briefly, there have been 3 new medications that have got FDA approval and that are in active use since 2019. They affect different aspects of the sickle cell disease, different pathophysiology. There's also a bone marrow transplant, stem cell transplant, and there's gene therapy that's currently in various stages of clinical trials. The bone marrow transplant, they're doing that. I'm not going to say on a regular basis, because part of bone marrow transplant is making sure that you have a donor, and they have to be a donor that's matched. So if you have a family member, usually it's a sibling that's a full match, they will take you to transplant pretty much right away. Then there is the registry where they try to find a match. So there's an organization that's called Be the Match. I don't know if anyone has heard about that, but they do recruit people to give samples to become potential matches for sickle cell patients and other patients that require bone marrow transplant. There's gene therapy. Gene therapy right now is in phase 3 clinical trials. So they are doing that on sickle cell patients, subjects who are participating in that, and they have had some success. There's many, many drugs. I can't even begin to tell you how many drugs are right now in various stages of clinical trials to really help the sickle cell patient. People have said this many, many times. This is the right time for sickle cell because there's so many companies, pharmaceutical companies that are trying to develop medications to help not just pain. As Dr. Saraf said earlier, it affects wherever blood flows. And that's one of the things I want people who are on today to remember. Wherever blood flows, sickle cell can affect it. So that just gives you a perspective of the whole body. So just think of sickle cell as a blood disorder, and wherever blood flows, it is affected.
Wow. Thank you again for all that information. And there are several questions that are coming through. Are we aware of renal medullary carcinoma, RCM? A young lady's daughter passed at 5 years ago, and she had that unfortunate disease. But we can table a lot of these questions that I'm seeing. I believe that was the last question I did see. Again, I want to thank our panelists for helping us today get this much needed information out. I want to also encourage you that today until 6 p.m. here at Fellowship Chicago, you have the opportunity to come down and give something that can save someone's life. We say things like that all the time, but this is truly something that can save someone's life. You can come donate blood to help save someone's life. And we encourage you to do that today, until 6 p.m. Just come on down. We would love to welcome you and love to see you. Again, the links and information for this program are on the screen, and we encourage you to take those down. And again, we want to thank each and every one of our panelists for being here and those who attended virtually. Again, you have a great afternoon and continue in the fight for sickle cell awareness. God bless.